Hello, everybody. Dr. Kim Leishear here. I know I jumped on a little bit earlier. We'll give a couple minutes for people to join. Hope everybody's doing well and enjoying, hopefully, some spring weather coming up here. I know the days are getting longer, temperatures are getting warmer. I'm here in Michigan, so we have a little bit of a longer winter, but it's getting there. Hi, welcome. Just wait a couple more minutes for people to join us. We're going to be covering how to manage endometriosis pain, which there are a lot of things you can do to manage, just overall on a daily basis and even when you have flares. So I'm a physical medicine and rehab doctor at Pelvic Rehabilitation Medicine working in Michigan, and this is why I do this. I take care of chronic pelvic pain, but most of my female patients are either confirmed endometriosis through excision and biopsy or suspected. So this is why I do what I do, honestly. Hi. So good to see all of you joining. I think we're just gonna wait maybe another minute, then we'll get started. You can definitely send questions. I know there were some questions beforehand that I'm gonna try to cover on this talk, just about even just kind of things to manage endometriosis pain, including diet, supplements, that kind of thing. So there are definitely a lot of different things. Hi. Thanks for taking some time out of your afternoon here. Okay, great. Hi. All right. So I'm going to go ahead and get started. I'm Dr. Kim Leishear. I'm a physical medicine and rehabilitation doctor specializing in chronic pelvic pain and pelvic floor dysfunction. I'm at Pelvic Rehabilitation Medicine. I'm out in Michigan. So if there are any other people in Michigan or Midwest, hello. And glad you could join us. We're going to be talking about really managing endometriosis pain. And I really specialize in a non-surgical, non-hormonal approach for chronic pelvic pain. Like I said, most of my patients are endometriosis, either confirmed through excision and biopsy or suspected. Sometimes patients come to me and maybe they've heard of endo, maybe they haven't, and I'm talking about you possibly have endometriosis underlying, everything else, your pain, or your bladder symptoms, bladder pain, bowel symptoms, bowel pain, pain with intercourse, that kind of thing. So endometriosis is really a chronic inflammatory disease that affects the whole body. And endometriosis is the tissue like the inner lining of your uterus, called the endometrium. It's tissue like that. It's not exactly like that, but it's found outside of the uterus. So it really, and most of the time it can be found anywhere, but most of the time it's in the pelvic area. And these are inflammatory lesions that respond to hormones, particularly estrogen. And so suppressing hormones, like taking birth control or using an IUD, sometimes can help with symptoms. Sometimes that is through medication or birth control that is a combined hormonal pill, so estrogen and progesterone, sometimes just progesterone only. And they can be in many forms: pills, patches, and intrauterine device or IUD. Sometimes it can help with symptoms, and sometimes it can't. Sometimes patients just don't want to be on birth control. Maybe they're trying to get pregnant, and sometimes birth control is just not well tolerated. So there are definitely other options. So also endometriosis, even after surgery, some people still have pain. Some people have pain relief for a few months and then it comes back. So also lesions are not necessarily correlated with your level of pain. So you can have a few lesions, have minimal lesions, have a lot of pain, and you can have a lot of lesions and have very little pain. There are some people with endometriosis that are asymptomatic. They might find out maybe on a hysterectomy incidentally that they have endometriosis. So it can really vary. So I think that really speaks to, there's so many things that are generating pain in endometriosis. You know, removing, having a surgical excision, if you've had that done, that's a piece of the puzzle. That's kind of the tip of the iceberg. There are so many other things going on. Again, whole body inflammation, inflammation in the pelvis, whole body inflammation. The immune system is involved, so really improving your immune system helps. We'll talk about those other things. There are a lot of lifestyle modifications you can do as well. So that's really, because there are so many things involved, so many different pain generators, that's why our approach to endometriosis pain is multimodal. Really a whole body approach, holistic multimodal approach. And so there are different tools that you can use, different treatments that you can do for endo pain. And some days you may need a few tools, some days you may need all of the tools in your tool belt. It just depends. Okay, so endometriosis, the endo lesions really cause underlying inflammation in the pelvic area, kind of the release of inflammatory cytokines in the pelvis. Any underlying inflammation really can cause a guarding of the muscles, tight muscles. You know, if you have a tight muscle in your back or your neck, that's going to cause pain. So that tightness can cause pain itself, and the muscles actually go into a spasm. That tightness itself, those restrictions from the tightness can really restrict blood flow to the area that's important, that blood flow that's going to the muscles and nerves. And the tightness also can irritate, really cramp the pelvic nerves. Nerves really need space to properly function. So if you really cramp those nerves, they're just going to be painful, more sensitive, and really respond when they shouldn't be. So things that are normally not painful, like intercourse, pain with sitting, pain with bowel movements, now are painful. So, and things that are normally a little bit painful are really now a lot more painful. So that volume has been turned up. So you have that tightness of the muscles, the spastic muscles, decreased blood flow to the area, and then really these nerves that are just irritated. They're more sensitive than they should be. The pelvic nerves get more sensitive. Over time, the central nervous system gets sensitive. It's really that fight or flight, that stress response that's always on when it shouldn't be. So really treating both is going to help manage the endo pain, short-term, long-term. So really things that can really downregulate the nervous system, really help that fight or flight response are things like diaphragmatic breathing, pelvic floor physical therapy, goes more into detail about that. And also mindfulness meditation. That's definitely important for stress management, but also just calming the nervous system down too. All of that is important. And then cognitive behavioral therapy. We have a specialist, Dr. Milspont, in our practice who really focuses on that, and that's very, very helpful to really downregulate the nervous system. And there are medications that we use also to really desensitize that upregulated nervous system. That can be helpful. Either oral form, suppository form, that kind of thing. So what we do, really kind of helping the muscle tightness. I mean, we really do kind of office-based treatments, treating the muscles and nerves, treating that, getting those muscles to relax and get them out of that spastic state, really improve the blood flow to the area, really make space around those irritated nerves and calm down. So it's a combination, really pelvic floor physical therapy. We do, the treatments in combination to that, but things that you definitely stretching, yoga, pelvic floor physical therapy, some muscle relaxants, either we usually use it in the suppository form that can really, really help. So it's really going locally to the pelvic floor, that the area that you need to have it. So, and there are other things, anti-inflammatories, cannabinoids can be used, heat, ice, most of the time heat really works well. Hot baths can really help. Some things that you actually learn from pelvic floor therapy, some things you can do as kind of a home exercise program, are pelvic wands, using pelvic wands, dilators sometimes to really get that internal release to the pelvic floor. Sometimes TENS units are helpful to really calm those nerves down. And then massage, acupuncture, there are all these other tools that can be helpful. And so again, it's really in this setting of kind of lifestyle modifications can really make a difference, and decreasing the amount of inflammation in the body, improving the immune system, that's important, really focusing on gut health and the diet, getting probiotics as well. But gut health is important. Endometriosis patients, probably the most common symptom is really GI, constipation, sometimes constipation, diarrhea, fluctuating, but constipation, pain with bowel movement, feeling like you can't complete a bowel movement. But so not only do a lot of endometriosis patients have a lot of bowel symptoms, gut health is important for our immune system. Most of our immune cells, over 70% of the immune cells are located in the gut. So it's really important even for the immune system, definitely helpful for, getting the most nutrition out of the food you eat. So the other thing is really to decrease toxins. So really eat organic as much as you can, particularly with things that you can't peel. So things where you're eating the skin, so like berries, apples, that kind of thing. Limit plastic use, that's kind of decrease the toxins from that. Use fragrance-free as much as possible, really, soaps, detergents, anything that you're putting on the skin, skincare, that kind of thing. And for we're going to talk about diet, really kind of going into that. Also sleep. Sleep is important. Sleep is where you kind of, everything kind of recharges. It affects your whole system. So getting good sleep, good effective sleep is helpful. Just exercise, yoga. Exercise when you're in a lot of pain, it can be tough, but even just doing breathing, stretching, yoga, just starting with low impact walking, that kind of thing, and then kind of increasing as you can. But that exercise really can release a lot of tension, can decrease stress. Speaking of stress, really, kind of there's only so much, I guess, trying to decrease stress as much as you can, but life happens, but really how to manage it, with those techniques, really mindfulness meditation, even kind of using the senses, really listening to music sometimes, definitely the diaphragmatic breathing, deep breathing can help. But although, listening to music, for me, I love music. Also for me, I love looking at nature, that really calms me down. So, going for a walk in a beautiful area, just to get outside, the fresh air really helps. And I do you can even do like a moving meditation, walking, that kind of thing. Really, sometimes that can really quiet the mind. And cognitive behavioral therapy, that's another tool. There was a quote I heard recently. It said, there's nothing in this world that can hurt you as much as your thoughts. There's nothing in this world that can heal you as much as your thoughts. So there really is a mind-body connection that can really make a difference. And so talking about diet, so really I really talk to patients about anti-inflammatory diet, which is really a plant-based diet, very similar to a Mediterranean diet. So a lot of vegetables, fruit, nuts, and then you get your healthy kind of fatty fish, salmon, that kind of thing. Really eat organic as much as you can, particularly in those fruits or vegetables that you're eating the skin. And eat a variety of colors. You have all of the different nutrients depending on the colors of the food. So eating a variety of colors is helpful. Really limit things that are going to contribute to inflammation on the body or affect your immune system. So limit really animal products, dairy, meat, limit processed food, sugar, gluten sometimes can irritate things and cause inflammation. And hydration. Hydration is important. Water is the best thing. Kind of limit things that dehydrate you, like alcohol, caffeine, soda. And I don't know if you ever heard this expression, eat your water. So you actually, if you can get you can hydrate even through vegetables and fruit. Vegetables and fruit, most of the content is actually water. And your body, your cells actually get that water the best from vegetables and fruit, honestly. But drink your water, eat your vegetables and fruit, can really make a difference. And plant-based diet can also improve gut health that we were talking about. So there is a certain gut flora in your bowels, or your gut, that actually there's kind of a mix. You want the good bacteria to balance out the other kinds of bacteria, the bad bacteria. So sometimes there can be a fluctuation or dysbiosis of more of that bad bacteria there by diet, stress, that kind of thing. So really improving your diet can help. Probiotics, prebiotics, all of those are a good thing. Okay. And then some supplements. So magnesium is really important. It's used in over 300 enzymatic processes in the body. It affects energy, sleep, mood, bone health, muscles, brain function. So it can really relax muscles. So magnesium, there's a few different forms. There's glycinate that is the most absorbable, so helpful for mood, sleep. And magnesium citrate is more of a laxative form, so I usually recommend that for patients who are constipated or having that kind of an issue. So that's more just a laxative form. So I usually recommend about magnesium citrate, like 400 to 800 milligrams daily. You can start lower than that. Sometimes patients take higher amount depending on what they need, but also just really supplements you can get through, really antioxidant, anti-inflammatory. Vitamin D, it's important to have adequate vitamin D. Even get your levels checked. It's important to have vitamin C. Vitamin C you can take as a supplement. Omega-3, it's found in salmon, walnuts, flax seeds. Quercetin is actually a flavanol found in vegetables and fruit. It's an antioxidant. It's found in onions, cauliflower, apple skin. It really helps the immune system. It does a lot of things. In animal studies, it's shown to decrease estrogen and increase progesterone, which is that calming hormone. Curcumin is another supplement that's been shown is helpful for any chronic pain, inflammation. And it's a polyphenol found in turmeric. It does a lot of things, including anti-inflammatory, antioxidant, hormonal regulatory properties as well. In lab studies, it's shown to reduce estrogen production, which really may help endometriosis patients. And then in animal studies, they've looked at supplementation with curcumin and found a decrease in endometriosis lesion size, also a delay in development. Also, there's a decrease in inflammation by decreasing expression of those pro-inflammatory cytokines. And in human studies, it's shown also to decrease inflammation as well. I'm just gonna pause right there. I'm just gonna see if I missed any questions. Okay, I just said, how do you improve your immune system when it's been so beat up for so long? I have stage 4. Okay, well, thanks for your question. I'm sorry you've been going through all of that, and it can start now. I mean, I know it's sometimes been going through it for a long time, but really I feel like, kind of lifestyle modifications is a good way to start. Definitely, diet, if there's anything particularly, and then also, kind of, how your symptoms are, things are triggered by certain kinds of foods. You can always kind of keep a food diary, that kind of thing, but you can really focus on, just really plant-based diet as much as you can. That could be really helpful. Some of the supplements that I mentioned can be really helpful. And, probiotics, really improving your gut health. Again, that gut health is, the gut is so important for the immune system. Okay, to see if okay. All right, and then, so, really supporting the immune system, really diet, exercise, decreasing stress, all of those things can be really helpful. I think I have the other, let me see. What was the name of the one found in cauliflower and apple skins? That's quercetin. So it's quercetin. That's the quercetin. So that's really a powerful antioxidant. I think that's probably the most kind of antioxidant, anti-inflammatory to really help. So that's in onions, particularly in red onions. And if you eat it raw, that's the best. So I've been having more raw red onions in my salad since I picked up on that. But cauliflower, apple skin. Yeah, of course. Thanks for your question. I think there was one other supplement that's been showing promise, especially with just inflammation and, kind of decreasing the inflammation can be helpful for endometriosis pain. NAC, so N-acetylcysteine, it's found in onions. Again, onions, garlic, power foods right there. It really it downregulates inflammatory protein activity. And they've done animal studies with endometriosis, and it causes significant decreases in lesion areas, decrease in just overall inflammatory markers in the pelvic area, and also effective in reducing endometriosis related pain symptoms, size of endometriomas as well. So that might be something to look into. Again, really, so all of the supplements really should just make sure, just check with your doctor if you're okay. If you can take that, if it doesn't, make sure it doesn't interact with any other medications that you're taking. But there's another study that showed the combined effect of NAC, alpha lipoic acid, and bromelain significantly decrease pain in women with endometriosis. Alpha lipoic acid is an antioxidant, and bromelain is actually found in pineapples too. So that's so promising, definitely promising. So that can help you. All right, and I think there was another another question, kind of or statement, just general, kind of having more awareness of just primary care physicians, gynecologists, other providers to help endo patients manage pain. So I really think that, starting with, patients really just being their own advocate. Finding a specialist who really understands endometriosis, like a pelvic pain specialist, like the ones in pelvic rehabilitation medicine. I'm trying, it's one of my missions to really spread the word to gynecologists, urologists, GI doctors, PCPs, primary care physicians, when they, people start first having symptoms, so starting in their teens, really, to get, at least, kind of on the lifestyle modifications, pelvic floor therapy, really starting those treatments so it can really be managed. Okay, how does having an autoimmune affect your hormones, reproductive organs, and bladder? Autoimmune, so it's your body's system really attacking itself. So that's in that autoimmune disease, because it can really affect not only, so it affects your immune system function, it also can increase inflammation. And inflammation, stress on the body really can affect your hormones, really. So it all can be in reproductive organs, which are affected by the hormones as well. It can really affect all of those areas because it's really a systemic effect. I hope that helps. Okay, will this live be saved? I believe so. I think they're all automatically saved. And I know throughout this month, or other providers really going specifically into kind of bladder pain, bowel pain, what to do post-excision, really talking about diet as well. So they'll be talking about diet, and also even just, awareness, other providers, how that can happen. On my end, I really try to reach out to people, kind of providers who my patients have seen. Maybe my patients have seen, a lot of times they've seen a lot of different providers, whether it was, gynecologist, GI doctor, urologist, and maybe not a lot was done. Maybe workup was negative. Most of the time things are really unremarkable, but there's still a lot going on that we can treat. So there's a lot of nerve and muscle issues, underlying endometriosis, sometimes even other things going on like bladder pain syndrome as well. Okay, do you recommend a low FODMAP diet? Yeah, that can be helpful, especially in other kind of IBS type, definitely have that can be underlying as well. Any kind of IBS, irritable bowel syndrome, inflammatory bowel disease, low FODMAP can be helpful, especially if a lot of bloating. That can really be helpful. And then, would you consider sugar a common inflammatory trigger? Yes, absolutely. Sugar, processed food, you have to be careful of hidden sugars. Not even in foods that are not necessarily sweet, there's a lot of sugar in there. So have to be, if you can cook your own food and you know what you're putting in there, that's the best. But kind of read labels. But yeah, sugar, absolutely. Right. And see if there are any other questions. I apologize if I missed any question. Hope that was helpful. Again, there's definitely things that you can do. There's so many things, some of those things that I talked about, some of those for some patients can be really helpful, certain things, and other things can be helpful for other patients. So really a kind of a lifelong management. Tools that you can use. Again, sometimes you may need a few tools, sometimes you need all of the tools. Of course, you're welcome. So glad you can join. It's a lot of good information I know coming up this month too from the IG Lives. The more information we give to people, to patients, to other providers, the better. Thank you. Thank you so much. Thank you so much for joining, and hope you have a wonderful rest of your day. Take care.